So as the panelists are coming forward, let me introduce myself. I'm Jay Burns. I run a clinic in Dallas, and I'm National Medical Director of Cosmetic Physician Partners. I work with Dan Schachter, who spoke earlier today. As you're getting your seats, I think the order of the day was I have so many questions for the presenters, but I'm just more of a figurehead today, so I'm not going to be able to do that. So I do think the panelists are going to talk and ask questions, and we can go through all those, but I would like to make a couple of comments that I wanted to start, like Aaron said, I want to start with gratitude. Thanks to Grant for allowing me to participate in such a conference. This is fantastic. When I look back at 35 years of me doing this, it goes all the way back to '86, and learning. There was nobody to teach me lasers, so I learned lasers from physicists. And so I would tell you that I don't know that we've been in a better time with more advanced technology in the non-surgical realm. I'm a little bit of a unicorn in plastic surgery who is reaching out to the non-surgical, but we are in a crazy time. Those 4 presentations were a broad spectrum, and it's whoever picked those panelists were fantastic, because there's a lot of there's just a lot of information that was just giving on some incredible new stuff. So I'd just like to start off, and we'll just go down the line and maybe introduce yourself and tell them a little bit about yourself briefly, and then your comments on what you heard. And we don't have to stay within the speakers. We could talk about new technology as well. And then I'm hoping that the audience we can have time for questions from you as well. So that's kind of how we're going to do it. Why don't you start there?
I'm Mark Epstein. I'm a plastic surgeon on Long Island, private practice. I've been in practice about 30 years. I've seen a lot of lasers over the years, and I used to be married to a dermatologist, so I was at all the dermatology meetings as well. And I've seen the evolution of technology, and it's nice to see how things have been combined into a platform. Certainly, if you're considering buying a laser, you don't want it to be in your closet collecting dust in a couple years. And I commend these companies for creating a platform, but also scalability and the ability to upgrade your lasers so that your lasers, you get as much use as possible, is important. And now we're into the next phase of improving accuracy, safety, predictability, and taking out the errors and inaccuracies that make the laser more technician dependent, and making it, I hate to use the word idiot proof, but the technology is significantly improved, and I applaud the engineers and physicists who've designed this, because this is, I think, the next hurrah in creating something where you can get more predictability in your results.
Good afternoon. My name is Dr. Walter Joseph. It's an honor to be amongst you all. I'm a plastic surgeon based in the Los Angeles area. I'm part of a 2-surgeon practice. We have offices in Beverly Hills and Pasadena. I'm fortunate that with both of our offices, we probably have over 50 different devices. So I've been able to, relatively early in practice, try out all these devices, see what works in my hands, what works for my patients. And so I'm excited to, hear what you all have to say and what you guys have to say too.
Hello, everyone. I'm Justin Perez. I'm the medical director of Marina Plastic Surgery and Med Spa. I love the theme that's going around about starting with gratitude, and so I just want to take a moment to thank Dr. Burns, because I trained at UT Southwestern, and he had such a strong presence there. And when I came through as a resident, I would talk to others who trained at other programs, and they were stunned that we were even learning about lasers, and that was even part of the curriculum, and that was something that was beaten into our heads just as much as surgery. And I credit you for that, because you were one of the forefathers of that, and Dr. Jeff Kinkle. And I wouldn't be sitting up here with as much passion for these devices and bringing them to our patients if it weren't for you. So I really am humbled by that. And so, yeah, we all have a variety of devices in our practice, and like Dr. Joseph said, it's about figuring out what works in your hands and what's predictable.
So well, first of all, thank you for your kind comments. Grant told me you taught him everything there he is to know about lasers, but that's not true. You know that. So tell me a little bit about what you guys are using in your practice today. Maybe even comments on what you heard, questions you might have, and then what in your practice have you seen as the best technology in the last year or two that's made the biggest difference in your practice going down the line?
In my practice, we have the Jewel X with the BBL and the clear silk and the halo, along with the ablative and the profractional. We also have a Moxie with the BBL, and we have the Barrett. Our practice is mostly on skin rejuvenation, and having this complement has given us some excellent results. Patients are extremely happy. We've been happy with the equipment, the performance of the equipment, and I think it's going to, in the end, be a very good investment for us.
Okay, perfect. Dr. Joseph?
Yeah, so in terms of the presentations, Cutera, we have the AviClear device, so the 726 acne device. I think what's cool about the AviClear, as mentioned, is that, this is a wavelength that was tuned exactly to target the sebaceous gland, so I think it does do a really nice job for that severe acne patient. You really have to market it, specifically for that. Not every med spa or every aesthetic practice is going to have a big influx of acne patients, so the marketing aspect can be a little bit difficult, but it's an effective device. In terms of other lasers, we also have the Jewel X, so the Halo and the BBL. The Heroic seems awesome, so maybe we can get that upgrade. No, but the Halo and the BBL have been great in my practice to treat, so many different skin conditions. In terms of darker skin, I see a lot of Asians in my practice, people of color in my practice. We also have the Cynosure PicoSure Pro. I love the PicoSure Pro for specifically treating dark skin types, treating PIH, treating melasma has been really great in my hands. And for, as a 1064, we also have Cutera's XLV, great for telangiectasias, vessels, reds. So those are kind of my workhorses.
So before we go, Dr. Perez, I have a couple of questions for you because you raised a couple of issues there, or a couple of things I wanted to talk about. Is that, just here to play devil's advocate, right? So the PicoSure, in my opinion, historically, is probably one of the greatest advancements for a laser geek like myself, without a place to go almost. It was so expensive initially, and we thought it was going to be amazing for tattoos, and it was better, but maybe it was kind of a little bit of a letdown there. And so I'm interested to hear what you said about the use of your PicoSure now, and it sounds like you found some places for that. I just wanted to, could you expand on your use of the PicoSure? And for anybody in the audience, would that be the first laser you bought? Where would that be in line?
Yeah, so I think in terms of the PicoSure Pro, I think you really it does fill a very specific niche.
Yes.
You really need to have that darker skin patient population that has pigment. That's more or less one of the main applications that I use for it. I do think it is also probably the best laser for tattoo. The 755 nanometer along, and if you do get the 594 handpiece too to treat the reds, I really love it for tattoo, and I find that my patients do need a shorter series of treatments for tattoo than say with other lasers or with even the older PicoSure or the Pico Way. So I think say in an Asian patient with pigment, then that's kind of my workhorse. Also, even in like a Fit 6 with PIH, I've seen the PicoSure Pro be really successful with that.
Right. And so I would say one thing that has been amazing to me, I've changed from, it was between Long Island and Dallas Plastic Surgery as being the biggest, we go back and forth, the biggest practices in the country, and now I've gone solo in the last 4 or 5 years, and I would tell you that I have preceptorships, and at the end of every one, I say, these are the 7 new things I'm doing in the last 3 years based purely on technology. And one of the things that we're doing that has been a tragedy that we couldn't do before is we can treat people of color with many different ways, from the thulium lasers that we have to the PicoSure. And I'm telling you, the Avava was an amazing presentation to me. I thought it was fantastic. What a great way to go. And anytime Rox and Dieter put their name on a list and the people you have up there, I'm paying attention. So I can't wait to see more about that. It just intuitively, it's like most things, I can't figure out how you did it, obviously, because Rox is like, and Dieter are crazy. But if you could do that, you bypass where the melanocytes live, and bypassing that, what an amazing thing to be thinking about going forward. And if it was anybody else than Rox and Dieter, I'd probably say it's BS, right? But you never say that about Rox and Dieter and Hobart and Negus and those guys. So going forward, Dr. Perez, what about you in your practice? What are you using now, and what would you tell that's given you the biggest boom over the last few years?
Our workhorse is the Cytom platform. I mean, it is that platform that you are going to hang a shingle. It's where you want to, it covers all the bases of all your young patients, mild to moderate early skin changes, all the way up to your facelift patients that need aggressive resurfacing, constantly being upgraded, always with a mind toward patient safety and reproducibility, which always, speaks to my heart. And I think the heroic, I got to get my hands on it 2 days ago with a prototype, and I'm like salivating at the opportunity to have it in our office. It's all I've been thinking about. But it's really funny because you go back and you reflect on when you started to learn these technologies and the stamping and the higher energies, and it was so painfully slow you just wanted to pluck your eyebrows out, and now to see this technology that can be reproduced with different experience levels and ultimately safety. I mean, we've all had those patients in our practice that are stripy, and fortunately it doesn't happen often, but those patients are very upset, and sometimes it isn't a burn, it's just incomplete treatment, right? And so when you tell the patient what you're going to need is another treatment, they look at you like you have 10 heads. So I think it's going to address a real need for our patients, and the technology is really smart. So 10 years ago you had to learn it a little bit the harder way, and now it's increased the learning curve. So I love that. The Cytom platform, I mean, it has something for every one of our patients. I mean, even if it's mild skin laxity and the skin tight component, the light-based component addresses all the usual photo aging that we have to deal with in our patients. I mean, Halo, I'm always impressed with how much diversity you can get out of the Halo with adjusting the settings, right? Like you taught us, Dr. Burns. It's not just the technology, it's how you adjust the settings, and you can get aggressive with it, and you can treat acne scars and adjust the percentage of coverage, and then the aggressive resurfacing, I think, will always be my favorite personally, just because I'm a surgeon and I like seeing those beautiful results on our faces, on our facelifts. We do also use the Clear and Brilliant and 1927, and that's safer for darker skin types. And Moxie has filled in that gap really nicely, right? Because I do have those Clear and Brilliant patients that kind of max out. Like they're like, okay, I've done three or four Clear and Brilliants. What else you got? And I think the Moxie fits in there really well. So, Cyton's the Bentley of lasers, as Grant says, and I believe that.
Let me, as we close, I want to get some questions if we can. I don't know how much time, if I can let me run over or not. But this is a safe room for me to say this because I think it's heavy industry, so you wouldn't believe that I would say this, but I've caught a lot of crap in front. You wouldn't say this in front of our plastic surgery colleagues, but I think people thought Burns can't operate. That's the only reason that he kind of can do lasers. So so I just was building the non-surgical before it was even cool. And now all my residents are coming back. My preceptors are full. I mean, it's a great time, and I think it's technology. So I'm just going to talk about one thing and get your comments on it, is that the reason we're at the head of where we are in technology is because the companies have been allowed to grow. And so for years I said, look, I'm not worried about disposables. I've seen so many companies come and have a great product, and then they can't sustain it, they can't sell enough boxes. And so I'd love your comment for the audience is like, for me, if I can build the disposable and do it in a way where they win and we win, it's why we are today where we are. So I would love to know, like, if we talk about this in plastic surgeons, they still get pissed off because, you know, they got to buy a disposable, but they can't have one without the other. We're at a beautiful time in history where we've got all this technology, and I think it's because we've allowed industry to grow, and I'd love your comment on that and the partnership that we have with them. Disposables. Anybody want to talk, or is that just me?
Well, disposables is kind of like a necessary evil, you know. I have to write out that check every month for those Halo hand pieces, but on the other hand, it's all about the results and patient satisfaction, and if your patients are happy, your practice is going to grow. If your patients are not happy, it's not. So if this particular technology warrants a disposable, it is what it is, and you just deal with it. I spend a lot more on some other disposables that I use in the operating room, so it's a minor inconvenience. Yeah.
Yeah, I mean, I think these days, if you're not approaching these diagnoses with a multi-pronged, you know, treatment plan, then you're doing the patient a disservice, you know. So I tell my patients, yeah, we can cut and lift and, you know, do whatever, but in the end, we can't, you know, effectively clear the skin. That's not in our hands. We can't, you know, stop the facial muscles from contracting. You know, it's the same thing I tell my patients. Yeah, you will need maintenance. This is not a one-time thing. You will need the lasers. You will need the Botox. You know, all of those things are part of your long-term plan, and I make sure that they understand that, and you know, that's the only way that they're going to get a satisfactory or a great and durable result.
Yes.
Yeah, I mean, I've never thought twice about the devices needing disposables, and maybe that's just the time and generation that I came down the pipeline.
Believe me, there's a bunch of people.
I was raised with it, so to speak, and so maybe there was a time where people griped about it, but it's all I know, and it's such a marginal, like you said, we spend so much more money on other things in surgery, so you know, a couple $100 for a tip that you need to give the treatment, that's going to be several $1,000s.
Well, I just remember having the conversation with some of the people at that table coming to me and saying, man, we've never done this. We've never had a disposable. What do you think? I said, do the freaking disposable, man. I mean, I want you to build more stuff. And here we are with all the products that you guys have mentioned because we can do that. And that should be true of, it's not just one company, it's all of them. So I just wanted to get that out. I think we as plastic surgeons should defend that more, because this is why we're here today, because we've allowed a partnership to develop. We don't want to be gouged. We don't want to, you know, we don't want to be oversold. We want to, I'm always fighting back on costs, but the point is it's worth time. It's worth discussing that. Any questions from the audience real quick before we close? Yes, sir. Steve. What did he say? Listen, I knew Ronan was going to say something. What did you say again now? I'm old, I can't hear. What did he say? I'm not sure I want
He's ribbing you a little bit. He's ribbing you.
All right, here goes second time.
Here we go, buddy.
Just to clarify, I thought it was true that you got into lasers because you couldn't operate.
That is true. That is true. That is true. I fooled him for a long time, though. I'm interested in the alopecia areata, man. I'm wondering if this laser can help me out a little bit. I've never heard of a laser doing alopecia areata, so I mean, I'm really interested in hearing about that. I don't know how that works. Any other question? All right, it's 5 o'clock, I think. It's happy hour, and I hope you've had a good day. All right. Is that right? Is there anything else? Yeah, good.